Hello, I am Dr. Sacher, and I specialize in geriatric medicine. Welcome to Integral Health. Today, we are going to address one of the most difficult and often whispered topics in end-of-life care, the physical signs that signal the body is preparing to shut down. This conversation requires courage, but it is essential for achieving peace and providing truly compassionate care. We are discussing a specific visible change, a distinct discoloration that often appears on the skin, particularly the arms and legs, sometimes just days before an elderly loved one passes away. It is a purple, blue, or marbled pattern, and it terrifies families because it appears suddenly and dramatically. Many people see this color and immediately believe they have failed as a caregiver, that the person is freezing, or that they are suffering a terrible internal injury. I want to tell you about a patient I cared for years ago. Let's call her Eleanor. Eleanor was 92, full of spirit, living comfortably at home, but her heart had grown tired after a long and challenging life. Her daughter, Sarah, was her devoted caregiver. Sarah was meticulous. She tracked every pill, every meal, every hour of sleep. She was prepared for emotional loss, but she had no knowledge of the final, profound physical transitions. One cold Tuesday morning, Sarah called me, frantic. Her voice was shaking, high-pitched with pure panic. "Doctor," she whispered, "Eleanor's arm, it looks bruised, but it's not a bruise. It's purple and white, like marble, and it's spreading from her hand up to her elbow. What did I do? Did I let her fall? She isn't responding the way she was yesterday." The fear in Sarah's voice was palpable. She thought she had somehow failed, that she had let Eleanor suffer an injury she hadn't noticed. I immediately understood what she was describing. It was not a failure of care, it was the natural physical process known medically as mottling, a sign of the circulatory system beginning to shut down. I knew, and I had to gently tell Sarah, that this was one of the clearest physical indications that Eleanor's final time was approaching, likely within the next 24 to 72 hours. Think about Sarah's confusion. She was looking for a simple bruise, maybe a treatable rash, or something we could fix with a prescription. Instead, she was faced with a deep, unsettling color change that seemed to scream, "This is the end," without any clear context. This moment, when you see that dusky purple-blue or reddish web-like pattern, known technically as livedo reticularis, or simply mottling, is when panic usually sets in. You see this color often starting on the fingers, the hands, and moving up the forearms, and you feel helpless. You ask, is she cold? Is she in terrible pain? Can we reverse this with a blanket or medication? Let me be perfectly clear. When the body reaches the very final stage of life, its core function shifts priorities dramatically. The heart, already weakened by age or disease, can no longer pump blood efficiently enough to maintain robust circulation to every extremity. The body must make an immediate, critical choice. It withdraws blood flow from the periphery, the fingers, toes, and skin, to protect the vital core organs, the brain, the heart, and the lungs. This withdrawal of richly oxygenated blood causes the skin to cool rapidly and take on that distinct marbled, blotchy appearance. The blood pools under the surface because the vessels are no longer receiving the necessary pressure to keep things flowing smoothly. That pooling gives you that dark, almost bruise-like coloration. It's not a bruise. It is the clearest visual evidence that the circulatory system is slowing to a necessary stop, redirecting its last efforts to the central core. Many doctors hesitate to talk about this because it feels too heavy, too definitive. But I believe strongly that knowledge is the foundation of truly compassionate care. If you understand why that color is appearing, that it is a systemic, unavoidable process, not a sudden injury you could have prevented, you can shift your focus from attempting the impossible reversal to providing necessary comfort. The appearance of this specific color is not a symptom we treat. It is a sign we interpret. It tells us that the time for aggressive intervention is past, and the time for profound, gentle presence is now. In the next part of our discussion, we are going to dive into exactly what this color means in terms of the body's final timeline, and crucially, what you should and should not do when you see it. We will discuss pain management, skin temperature regulation, and perhaps, most importantly, how to transition your emotional focus during these final sacred moments. Stay with me. We are going to move past the fear and focus on truly integral, dignified care. We've discussed the emotional transition required during the final stage of life, moving our focus from extending time to ensuring dignity and comfort. Now, we must address the physical reality that accompanies this shift, specifically, the visual signs that indicate the body's systems are winding down. This conversation requires clarity and directness because recognizing these signs allows you to adjust your care immediately, prioritizing comfort over aggressive intervention. Let's talk about the color. Many caregivers notice a distinct change in the skin, often starting on the arms and legs, sometimes days before death. This is often described as a lacy, web-like pattern, usually blue, purple, or sometimes deep red. Medically, we call this mottling, or livedo reticularis. This is arguably one of the most reliable and non-reversible signs of imminent physical decline. It is not caused by cold, it is caused by physiology. To understand why this happens, we must recognize that the body has initiated its final involuntary prioritization process. Think of the body as a complex machine that is critically low on fuel. The remaining energy and oxygen must be conserved for the most vital systems, the engine room. The engine room, in this case, is the brain, the heart, and the lungs. When the heart and circulatory system begin to struggle, a process we call reduced cardiac output, the body's automatic response is to redistribute the remaining blood supply. It pulls the blood away from the periphery, meaning the extremities, the fingers, toes, arms, and legs, and shunts that blood to the core. This is a survival mechanism, but in the end stage, it is irreversible. When the skin receives significantly less blood flow, it also receives critically less oxygen. That blood pooling in the tiny capillaries just beneath the skin's surface, which is now deoxygenated, creates that distinct, lacy, purplish-blue pattern we call mottling. This mottling typically starts at the distal ends, the hands and feet, and slowly progresses up toward the trunk. As the process advances, the skin may also feel cool to the touch, not because the person feels cold, but because the circulation necessary to maintain temperature equilibrium has ceased in those areas. Now, let's go a step deeper and look at the control center, the nervous system. We often speak of things like neuroplasticity in positive terms, the brain's incredible ability to adapt and rewire itself throughout life. But I want to introduce an analogy for what happens in these final moments, which I call late neuroplasticity. This is not plasticity in the sense of learning or growth, but in the sense of involuntary catastrophic adaptation driven by severe systemic stress. The brain, even as consciousness wanes, continues to manage the fundamental needs of life. When oxygen and blood pressure fall critically low, the autonomic nervous system, the automatic pilot that handles breathing, heart rate, and digestion, stops trying to maintain all systems equally. It makes ruthless, instantaneous choices. The signals sent from the brain to the vascular system are no longer geared towards maintaining optimal overall health or comfort. They're geared toward prolonging the function of the core organs for the briefest possible time. This massive, reflexive shunting of blood to the core is the neural signal expressing itself physically. The lacy, purple color is the visible result of this final, involuntary neurocirculatory adaptation. It is a signal that the sophisticated regulation of the body has collapsed, replaced only by these raw emergency protocols. For caregivers, it is essential to distinguish between the temporary pallor or coolness of normal aging or a transient illness, and the mottling associated with the end-of-life process. Normal aging often involves thinner skin, easier bruising, and slightly less efficient circulation, meaning the elderly person might get cold hands or feet more easily. This is normal senescence, the natural progressive deterioration of function. These changes are stable and chronic. Mottling, however, is acute and progressive. If an older adult has merely cold feet, wrapping them in a warm blanket or rubbing them gently will restore color, warmth, and peripheral perfusion relatively quickly. If the color change is due to end-stage systemic failure, the pattern will be fixed. It will not blanch, turn white, when you press it lightly. It will not disappear when you warm the person. Furthermore, mottling is almost always accompanied by other unmistakable signs of physiological decline, such as Cheney-Stokes breathing, the cyclical, irregular periods of shallow and deep breaths, or profound unresponsiveness. When you see persistent, progressive mottling accompanied by these other changes in breathing or consciousness, you are witnessing the body's final curtain call. This is not a sign that the body is fighting to recover. It is a sign that the body is making its final systemic surrender. Understanding this physiology changes our immediate treatment goals. At this point, aggressive measures like fluid replacement or stimulants will not reverse the process and will often only cause greater distress, such as fluid overload in the lungs. Instead, your focus must transition entirely to comfort, ensuring the individual is warm but not overheated, repositioned gently, and most critically, kept free from pain. The mottling itself is usually not painful, but the associated reduction in circulation can lead to discomfort, especially in the feet. The purple color, while frightening to witness, is simply a map of where the circulation has stopped serving the skin. It is confirmation that the body has moved into its terminal, irreversible phase, allowing us to pivot our care to be truly compassionate and integral, focusing solely on peace. The appearance of that marbled, purplish discoloration on the arms and legs, livedo reticularis, or mottling, is the definitive physical signal we discussed. It is the body signaling that its energy is being concentrated solely on the core functions. This phase, while deeply emotional for the family, requires an immediate and decisive shift in strategy. Our goal changes entirely. We move from attempting to cure or reverse to ensuring absolute, uncompromising comfort and dignity. This is your practical, step-by-step protocol for care when this sign appears. It is direct because clarity is kindness in these moments. Phase 1, the immediate pivot. First, if you have not already, you must contact your medical team. If your loved one is already under hospice or palliative care, notify the nurse immediately that the terminal circulatory changes have begun. They will activate the final protocol of care. If they are not yet enrolled, call their primary physician or geriatrician and report this physical change. The medical goal instantly becomes symptom management only. We stop diagnostic tests, blood draws, and unnecessary medication routines. We focus on 4 core pillars: pain, breathing, restlessness, and dignity. Pillar 1, advanced pain management. Pain is the enemy of peace. Even if your loved one is unconscious or minimally responsive, we must assume that discomfort, pressure, or internal organ changes may be causing pain. Scheduled dosing is essential. Pain relief should no longer be given as needed. It must be given on a schedule, typically every 3 to 4 hours to ensure constant coverage. Do not wait for a sign of grimacing or restlessness. Those are signs that the pain is already severe. Do not fear the dose. Many caregivers fear that increasing opioid medication, like morphine or hydromorphone, will hasten death. Let me be clear. Standard palliative doses, when used appropriately, do not kill the patient. The underlying disease process does. Your refusal to manage pain adequately, however, will increase suffering. Follow the dosage instructions provided by the hospice team. They are trained to titrate the dose, to find the minimum effective dose that achieves profound comfort. Addressing discomfort beyond pain. Sometimes restlessness is mistaken for pain. Use softening techniques, adjust the bedding, ensure the room is not too bright, and check for a full bladder, a common, easily remedied cause of distress. Pillar 2, breathing and secretions management. Breathing changes are common in the terminal phase. They can be irregular, shallow, or punctuated by periods of rapid breathing. The 2 issues we must manage are discomfort and noisy breathing. Positioning for comfort. Adjust the patient into a semi-Fowler's position, where the head of the bed is elevated about 30 degrees. If lying on the side is comfortable, this position is often better for minimizing secretions pooling in the throat and lungs. Use supportive pillows to keep them stable and comfortable. Managing terminal secretions, the death rattle. As the person nears death, they lose the ability to swallow or cough up saliva and mucus. This causes a gurgling, rattling sound as air passes over the pooled fluid. This sound is extremely distressing to families, but please understand, often, the patient themselves is unaware of it. Your intervention here should be external, not internal. 1. Repositioning. Turn the patient gently onto their side. This uses gravity to help drain the secretions to the side of the mouth. 2. Medication. This requires physician orders, but specific anticholinergic medications, like scopolamine patches or atropine drops, are essential. These medications dry up the fluid production in the lungs and throat, effectively managing the sound. Suctioning is almost universally avoided in palliative care, as it is invasive, painful, and often increases irritation, leading to more secretion production. Trust the medication protocol. Pillar 3, the hard truth about hydration and nutrition. This is often the most difficult instruction for families to accept, but it is one of the most important steps toward comfort. We must stop artificial hydration. At this stage, the body is naturally shutting down its systems. It no longer requires or processes fluids effectively. Continuing IV fluids or tube feeding can cause serious discomfort. 1. Edema. Fluids leak into the tissues, causing painful swelling in the hands, feet, and face. 2. Pulmonary congestion. Fluids can collect in the lungs, exacerbating the gurgling sound and making breathing harder. 3. Gastrointestinal distress. The gut stops moving and feeding attempts cause nausea, vomiting, or retention. The body releases natural chemicals during this process that act as natural anesthetics and sedatives. The feeling of thirst, as we understand it, often disappears. Death by dehydration at this stage is not painful. It is a natural, peaceful process the body initiates. The solution is meticulous. Oral care. While we stop artificial hydration, we intensify mouth care. This is where true comfort lies. Use soft foam swabs, dipped in water, specialized mouth moisturizer, or even a small amount of diluted lemon glycerin solution to gently swab the mouth every 1 to 2 hours. Keep the lips moist with a thin layer of balm. If the patient is still minimally responsive and can swallow, offer small chips of ice. Your focus is on a moist, comfortable mouth, not a full stomach or bladder. Pillar 4, environmental adjustments and physical touch. The environment must be tailored to peace. Remove sources of stress, bright lights, and loud, chaotic discussions. Maintain a stable, mild temperature. Mottling makes the extremities cold, but the patient may internally feel warm or run a low fever. Do not bury them under heavy blankets, which can cause distress and overheating. use light sheets and maintain a moderate room temperature. If their hands or feet feel like ice, use light socks, but avoid external heat sources that could cause burns or discomfort. Gentle hygiene. Aggressive movements are painful. When changing linens or positioning the patient, move slowly and deliberately. If a full bath is too much, use warm towels for a gentle sponge bath, focusing on areas prone to perspiration. Skincare and repositioning. Despite the mottling, gentle repositioning every 2 hours is still vital to prevent pressure sores and increase overall comfort. Use pillows to cushion bony prominences like hips and heels. The human element, communication and presence. This is where the caregiver's role transcends the physical. We know that hearing is typically the last sense to leave. Assume they can hear you, always. Speak directly and calmly. Talk to your loved one about happy memories. Tell them they are loved. Reassure them that everything is being taken care of. The dogs, the bills, the garden. Give them permission to let go. This is a crucial step in psychological comfort. Say, "It's okay, we are here, we love you, and you can rest now." The power of touch. Sustained, gentle touch is more calming than sporadic petting. Hold their hand continuously. Gently stroke their forehead or arm. This steady physical connection is a profound conduit of peace and security. Allow for silence. You do not need to fill the room with conversation or noise. The presence of loved ones, the simple act of sitting quietly next to them, is often the greatest comfort you can provide. Allow family members to visit, say their goodbyes, and share their feelings without rushing the moment. The purple mottling is not a sign that you have failed. It is a sign that the body is completing its natural process. Your job now is not to perform medical miracles, but to protect their final phase with unwavering dignity. Stop fighting the physical reality. Instead, embrace the emotional and spiritual needs of this transition. Focus entirely on peace. Trust your hospice or palliative team. Follow these protocols for pain and comfort, and know that your gentle, knowing presence is the most powerful medication you have left to give. It is an act of deep and profound love. Yes, your gentle, knowing presence is the most powerful medication you have left to give. It is truly an act of deep and profound love. We began this discussion focusing on a challenging physical sign, the change in skin color, the mottling, that marbled purple and red pattern indicating the circulatory system is slowing down. That physical change is clinical, it's inevitable, and it's a clear marker of the final days. But please, do not let that symptom become your sole focus. It is simply information. It should not be a cause for panic, but a clear call for transition. At this stage, your responsibility moves entirely toward ensuring dignity. Dignity is not about fighting the inevitable, it is about accepting it gracefully while guaranteeing comfort and absolute respect. We must remember that the patient, even if unresponsive or asleep most of the time, is still likely perceiving their environment. What does dignity look like in these final hours? First, it means impeccably managing pain. Always trust your hospice or palliative team on appropriate medication titration. Second, it requires non-abandonment. Never assume they don't know you're there. Hold their hand, talk to them about shared memories, whisper your gratitude and your love. This is the time to resolve anything left unsaid, even if it feels one-sided, because hearing your voice can be incredibly grounding. Third, manage the environment. Keep the room calm and peaceful. A quiet, soft light is usually best. Many families feel compelled to play loud music, or they allow a constant stream of chaotic visitors. I urge caution. The dying process requires tremendous internal focus, and external noise can be an irritating disruption. Focus on familiar, gentle sounds, and manage visitors to allow only 1 or 2 close family members at a time. This transition is sacred, and it requires sacred space. I know how overwhelming this period is. You may feel guilt, profound anxiety, or crippling sadness. This is normal. You're not just witnessing a death. You are experiencing a loss that will change you fundamentally. Give yourself permission to feel these things, but do not let that paralyze you in front of your loved one. If you need to step away for 5 minutes to weep privately, do so. Then come back composed and centered, ready to offer your steady presence. What if you haven't said the right goodbye? It is never too late. Often simply saying, "I love you," "thank you," or "it's okay to go now, we will be okay," provides profound relief both for the person dying and for the caregiver. Do not carry the burden of trying to force them to stay. The act of giving permission to release their struggle is one of the most loving and powerful gestures you can offer at the end of life. If they seem to be holding on, waiting for someone specific, a sibling, a beloved grandchild, and that person cannot physically arrive, sometimes a video call or a simple recording played softly can serve that essential purpose of connection and release. Remember the core lesson of this entire series. Recognizing the physical signs, whether it's the symptom of mottling on the arm, the changes in breathing, or the withdrawal from food, allows you to shift from an attitude of fighting to an attitude of integrated care. That crucial shift protects the dignity of the elderly person. As a geriatrician, my deepest hope is that this knowledge gives you strength, not fear. When you understand the map of this final journey, you can walk alongside your loved one with confidence, focusing entirely on comfort and connection. This is the definition of integrated health, addressing the physical, emotional, and spiritual needs until the very last moment. If this conversation brought you clarity and comfort, I ask that you share this video with others navigating this sensitive time. Knowledge is power, and comfort is paramount. Please subscribe to Saudi Integral for more direct, honest, and compassionate guidance on aging, health, and end-of-life care. Leave your questions and your own experiences in the comments below. We are a community built on respect and shared learning. Thank you for trusting me with this crucial and tender topic. Until next time, take care of yourselves and those you love.